auscultatory areas of heart that where will be auscultate for aortic, pulmonary, tricuspid, and mitral valves. So first of all, there comes right second intercostal space. Right second intercostal space is we will auscultate aortic area. Aortic area is present in the right second intercostal space, so we will auscultate it here. And the another one is, let me make it more clear, this one is right side, this one is left side. So right second intercostal space we will auscultate aortic area, and when there is any aortic regurgitation, aortic stenosis, we will auscultate here aortic stenosis especially. And here second left intercostal space we will locate tricuspid area here in left second intercostal space. And the pulmonary space is left side, while mitral valve is also from the left side, so we will be looking that where we can auscultate these areas. Now right second intercostal space we will look at aortic stenosis. Aortic stenosis we will look at right second intercostal space. In left side second intercostal space we will be looking for pulmonary valve sounds. In left third intercostal space we will be looking for aortic regurgitation. In left side left fourth intercostal space we will be looking for left parasternal border where tricuspid valve is there. Any anomaly related to tricuspid valve will be located there. Even left fourth and fifth intercostal space we will look for mitral valve as well. So in this picture we can look clear that right side and this is left side.